The Chinese medicine is given to each person based on questions that you ask in a consultation. So
Absolutely.
you find out about them by asking them questions, and then you match the Chinese medicine to who they are and what they're telling you.
Indeed, it's exactly that's the way. That should be the way.
Right.
That's why, if anybody tell you Chinese medicine have a magic medicine can losing weight, have a magic medicine can help with high blood pressure or raise sugar, or diabetes, that is nonsense to me.
So it just depends who you are listening to in the room and how you are like looking at their heat range.
Yeah, at least we have many choice of medicine.
Yeah.
But you need a doctor, you need Chinese people to tell you what kind of person you are.
Yes. And then from that.
And then we choose
make your
things.
own. Yes,
We choose
okay.
things. What is best for you?
And if they have like they're asking for something particular, maybe infertility, maybe that, you also take that into account, but really you're looking at the whole person.
Absolutely.
And you had a quote on one of your videos which said, you're joking, but it's also true. You said sometimes people come in, you give them the Chinese medicine herbs, they come in for something else and you give them the same herbs because you're treating the person. So of course that's what's going to happen.
Exactly. That's why many people tell me in public, "Oh, I forgot to tell someone else." I said, "Well, don't worry. I already covered everything. Even you said you're not saying."
I love that. Don't worry, we've covered everything, and that's true though, because you've really read who they are, what they're made, their structure.
Well, in fact, I've been practicing in UK for 35 years, plus China. I've been practicing more than 40 years. So I often tell people, just joke to them. I said, when you're walking in, I already know what problem you are, 50% at least. That's why sometimes when I'm on the street, when I sit in the coffee or tea and see people walking by, I can see their problem. People say, "Why don't you tell them?" I said, no, don't be nosy. So I respect their privacy. So I don't say anything. But I didn't want to say anything. So
cool.
I already knows.
I can't wait to hear what you have to say about me.
No, I already know what is the problem.
Yeah,
but
sure.
I'm not fortune teller. I don't want to be.
No.
But because everything from your hair, your face, your eyes, your nose, your skin, your lips, your nails, already give us lots of information about who you are really inside. Doctor know that. Even Western doctor knows.
Yeah.
If somebody have a kidney failure, the skin normally become very dark. If you have liver failure, there are lots of red dots come out. They know that. That's more obvious, but there's less obvious things we can still see. That is how the Chinese doctors, that's how we train our students to observe,
Yes.
to observe, to learn the body.
Someone who has only known Western medicine.
Yeah.
Talking to these people, if you were to encourage them to come into, to see a Chinese medicine doctor, why would you say have a go, try it out, just see what it's like? Why would you say it's a good idea to try?
For me, I never encourage anybody to come see me because I said, if you want to come, it's your luck. Because
Agreed.
you come to me, find me, it's your luck you find me. If you don't want to come, doesn't matter. Yeah. I'm very busy anyway.
Yes.
So for that. But of course, for people, we say to people, now, if you have a problem, anybody know that the bottom line, you want to solve a problem.
Yes.
In a way, you want to be safest way.
Yes.
You want the cheapest way.
Yeah.
And quickest way.
Yeah.
Okay, so now, I said to many people, if somebody, let's say, talk about, let's say, asthma or eczema.
Great.
Of course, I said you should see doctor, normal doctor, GP and hospital. And if they have any good way or any medicine that can help you, great, good luck for you. But if something they can't do it, okay, and you know that, if you see doctor for asthma, they give you inhaler all the time, okay? If you give you for eczema, they give you cream all the time. So that's the only reduce the symptoms, not treating the problem. You keep it going forever. So now it's not solve the problem, you only defer the problem. So therefore, what do you want to do there? Say, okay, try Chinese medicine. And of course, I will say to you, to go see a good Chinese doctor, number one, if they're not going to help you, not experienced enough, at least they should not harm you.
Right.
So the safety is number one.
Right.
I do believe if you do properly Chinese medicine, it will help you. But just give you the time. Because we said, there are linking in the body, everything. There's always a link something, but there's a subtle links, many things. If you change something, one thing can cause another thing change, and further this chain reactions. So therefore, ultimately, your problem will be better. Many people come to me for something like say, okay, I have a problems maybe with my eyes. I start treating the the stomach. And then they say, oh, I should see eye doctor, not see stomach. I said, don't leave that. You will see. Things will change. They will see the change.
If you realise you're just getting treatment and it's not actually going away, it's just soothing, the symptoms, and you want to try a different way, then perhaps Chinese medicine is somewhere you might like to go. And like you said, even if the doctor is not as well trained as, for example, you, which they still would never harm you based on the treatment. It's very hard to harm someone because it's all natural things that they prescribe anyway. Yeah. And it's cheap and it's quick.
My daughter is a natural doctor.
Wow.
Western doctor. Yeah. And my both brothers are doctor working in America, also working for the government. Right. Yeah. They're all doctors, Western doctors. They're doing good job. But as far as for all these conditions concerned, the result, are they really good? Only 40 years old, 30 years old, have this pile of fire been treating the pain. I say, this pile of fires, you go in the hospital, same hospital, you've been seen so many times and so many checkups, that cost a fortune for government. Yeah. And you're still in pain. Yeah,
that's right. Well, thank you so much for this interview today. It's been a pleasure talking to you. You're so brilliant. You have so much knowledge. And yeah, I've learned a lot. And it's just the start. We're going to look at other things. But yeah, thank you very much for your time.
You're welcome.
For your information. So yeah, thank you, Professor Key.